Hello, my name is Tara Danahy, and I will be discussing diversity and how it's related to children with autism spectrum disorder. My objectives for this presentation will be defining and understanding cultural competence, how cultural factors relate to treatment for ASD clients and their families, to learn more specifically about how race, socioeconomic status, and urban versus rural populated areas influence individuals with ASD, and recommended guidelines to combat cultural disparities. Cultural competence is the understanding of how culture and diversity may impact interactions between both the client and the professional. This includes race, gender, sexual orientation, religion, socioeconomic status, sex, age, and ability and disability. Competence is gained through this understanding and by appropriately responding to cultural differences that may arise during treatment. Competence is also gained through the professional also understanding of their own cultural differences. It's worth noting that cultural competence is not an end goal, but rather an ongoing learning process throughout one's lifespan. When interpreting client behaviors, clinicians must be sure that cultural bias is not interfering with their clinical judgment. This could impact treatment fidelity and can cause dissatisfaction among parents if behavior change goals are not in line with their cultural influences. Although there are many cultural factors to consider when treating clients and their families, this presentation will focus on race, socioeconomic status, and families living in urban versus rural areas. First, we'll look over race. Minority groups have been shown to look for diagnostic screening for ASD later in comparison to white parents. This may be because of distrust in the healthcare system and/or due to higher threshold for ASD symptom severity before seeking resources. Cultural expectations of socially appropriate behaviors and communication can vary between groups. Problem behavior or behaviors that may seem concerning are influenced by the cultural expectations of the observer or the family. Minority parents have reported to be more likely to receive ASD referrals and information from the school system rather than healthcare professionals. White majority are more likely to receive referral or information from their healthcare providers. White families also visited a larger variety of service providers outside of the school system compared to minority group parents and reported satisfaction with their healthcare providers, while minority parents reported more satisfaction for the school system services provided to their children and a satisfaction for the variety of specialists provided to them through the school. Guidelines during screenings include being aware that minority groups are underrepresented in ASD research, causing assessments to become biased. Use screening tools with caution when implementing with minority groups, and to combat this, interviews can be a great tool during diagnostic assessments and should be standard practice during screenings for culturally diverse groups. Screening tools should be refined to meet the family's cultural values. An APA cultural formulation interview is a great tool that the American Psychological Association provides to help formulate questions to ask and investigate when working with multicultural and minority groups. Socioeconomic status is determined usually by annual income, education level, and occupation. Socioeconomic status has been shown to affect early diagnosis of children with ASD. Higher socioeconomic status is also associated with earlier diagnosis and more services provided to their children with ASD. Healthcare is not universally available in the United States, which will ultimately affect families' ability to seek resources and diagnosis for their children in a timely manner. This also affects resources that will be covered under insurance before entering the public school system. Zhu and colleagues 2019 reported that 50% of mothers were unemployed and 91% of mothers stated that their family is faced with heavy financial pressure due to their child's diagnosis and related service costs. They found that increased financial pressures and low income negatively affected parents' mental health through an increase in depression, anxiety, and stress. Guidelines when working with families of lower socioeconomic status include being mindful of financial costs when recommending services to families. It's important to be mindful that services outside of the public school system can be costly and may not be covered under the family's insurance. Provide helpful financial resource information to all families, regardless of their socioeconomic status. Talk to families using less scientific jargon so they can understand and feel more involved in their child's treatments. Families can become overwhelmed with all the new information and face the reality of their child's deficits that come with an ASD diagnosis. Listen to the family's concerns and provide information that could be helpful to them in navigating their child's diagnosis. It's important for families to feel seen by their child's providers. Families living in rural areas have reported higher levels of stress associated with increased feelings of isolation. Many families become isolated due to living their new normal with their child who has been diagnosed with ASD. Many report that it was hard to continue friendships with lifelong friends by feeling like they no longer can contact them about daily life and feeling like they don't understand their struggles and don't want others to feel sorry for them. Families in rural areas may have limited resources provided to them. For example, there may only be one ABA clinic in their entire town. Some towns may not have any. Or if they're looking for a specific service, there might not be one within their town, like speech and OT and other related services providers, based on their child's needs. Because of this, many families living in rural areas have reported that they are forced to travel long distances for their child to receive their services. Farmer and Rupert in 2013 found that group parent trainings has been associated with a decrease in parental anxiety and feelings of isolation, an increase in parental feelings of knowledge and confidence. Formal group-based trainings are a great resource for families to gain knowledge about their child's diagnosis and related services, but also great for families to connect with each other and share their personal experiences with one another. This can help families feel less isolated and gain friendships with others who understand their new way of life. It's also recommended to be open-minded to telehealth visits for families living in rural populated areas. If families are able to connect with their providers via telehealth, even if that's just a simple phone call to update the parent on their child's progress rather than the family driving to meetings, may reduce stress for parents. When recommending services to families, be mindful of travel and transportation expenses. This includes the family's financial expenses on gas, car maintenance, bus or train tickets, but also the time it may take families to travel these long distances. This is the end of my presentation, and these are all the references when creating my presentation. I hope that this presentation was helpful. Thank you.